among these 2.3 million people who are dying every year are coming for most of the people who are not having the access to the occupational health and safety services. Now, before I go to the example of one industry implementation and aiming at improving those situations which I have been describing from a global picture to a national picture and to an enterprise which I am going to go. Before that, I wanted to take a sector where I work. I have spent almost quarter of a decade, a little more than 25 years in construction, and I thought I'll just give a little bit brief what does the sector mean and how we are trying to make an effort with it, which will, I think, serve as an example to a small in a humble way, so that we can see that how it can be replicated at other areas. As you know, I think these figures are well known, but I just like to give a small glimpse of it. It is one of the most important contributors in global economic development. Around 7 to 10% of GDP comes from it, but it also contributes to 2 to 3 times of the incidence of other industries. So I think it is a few times large. It has few times. The incidence rates is quite very high in comparison to other industries. The specific challenges is 20 to 30% of occupational deaths and injuries comes from the construction sector. 80% of workers have one or more. 80% of them have. 80% of the people who work in construction have one or more serious injuries. Almost 100% of the workers or people working in the construction sector have musculoskeletal disorder, and we were very glad to see that there was a presentation on the topic, and I'm sure people who are coming from various fields, including construction sector, will be highly benefited with the lecture. In fact, we were discussing how to expand this type of interactions more frequently to other sectors as well. 35% of the people have work-related lung diseases, and 70% of the workers working in the construction sector have work-related hearing loss. So this is the figure which we get from our national data. Now, what we can do to improve? There are many ways possibly, and I am going to share one of the ways where we wanted to bring a sort of integration approach with the other functions, because when we are talking about occupational safety and health, there is a possibility of that getting separated, but not getting integrated with the main business objectives. So we made some effort, small efforts, and we tried to integrate with our business processes, and I'm going to share it with that, and perhaps that may be all. So I'm going to share what we generally do in case of construction industry in implementing or integrating the HOS system. And I'm just finding it. Shall I escape and shall I close the file? Because it suddenly went off. Right? Now it's coming.